Good morning, dear students. We'll continue with the assessment of growth and development. In the previous session, we have discussed about the development as assessed with the different domains, and we have the personality development. And in the personality development, there are two theories which explains the personality of the individual. And among that, the first theory is psychosexual theory. This is a picture of Sigmund Freud, who is a theorist of the psychosexual theory. So, first of all, we have to understand what is the basis of the psychosexual development theory by Sigmund Freud. He believes that sexual feelings do not suddenly emerge during puberty and adolescence. They are present from infancy and gradually change from one form or state to another until sexual life is achieved. So, in each stage, instinctual sexual energy is invested in different biological areas of the body. So, this is the explanation of psychosexual development theory by Sigmund Freud. So, he believed that the sexual feelings are not suddenly emerging at a particular age of the person. It is present. That is, the pleasure-seeking behavior is present in the child, and will be continued throughout their life, but in each stage it will be taken from one area to another. So oral, anal, phallic and genital stages are the stages of psychosexual development in childhood, and during this time one area, biological area to another biological area, this will be changing. So this is the basis of psychosexual development theory by Sigmund Freud. So first we can see what is an oral stage. So in infant, that is less than 1 year age, he explains that the child belongs to oral stage. That is, birth to 1 year, the child will be in an oral stage. So during this time, the oral region or the sensory area of the mouth provides the greatest sensual satisfaction for the infant. So the child is getting maximum pleasure from oral region. So this is the explanation of oral stage by psychosexual theory by Sigmund Freud. Infant seeks pleasure on oral activities such as sucking, biting, chewing and vocalizing. So the child will take everything to the mouth, bite, suck, chew and make different sounds. So these are the activities which give pleasure for the child during infant stage. So this is the theory of psychosexual development and the explanation of oral stage in infant. So he divides the oral stage into two, that is oral passive stage and oral aggressive stage. Oral passive stage is for the first few months of the baby, and when the child gets the tooth eruption or the appearance of teeth, child becomes the oral aggressive stage in the infant stage. So this is the oral passive stage. Child will be doing sucking, swallowing, and during oral aggressive stage, when the teeth erupts, child starts biting and chewing. It is the explanation of oral aggressive stage by Sigmund Freud. So clear? So the first is oral stage. The child is getting sensual pleasure by doing oral activities like sucking, biting, chewing, vocalizing, etc. And in the oral stage itself, we have two substages, oral passive stage and oral aggressive stage. So the child is passive, means there is no teeth. The child will be doing sucking and swallowing. When the child gets the teeth, child starts with biting and chewing, which becomes the oral aggressive stage. So anal stage, that is the second stage of development of psychosexual development, that is in the toddler period. Already in the growth and the assessment of growth and development, periods of growth and development, we have seen that 1 to 3 years the child will be in the toddler period. So interest during this stage centers in the anal region. So the sphincter muscles develop and children are able to withhold or expel fecal material at will. The climate surrounding toilet training can have the lasting effects on children's personality. So this is the anal stage. Child will have control over the sphincter control or sphincter muscles, and child will be withholding the fecal matter or expelling when the environment is okay. So this is the explanation of anal stage, that is the child seeks pleasure by withholding and expelling the fecal material. So this is what is happening in the toddler period. And this is the suitable time for toilet training of children. The third stage is for preschool period, that is between 3 to 6 years, the phallic stage. So here the genitals becomes an interesting and sensitive areas of the body, and children recognize the differences between the sexes and become curious about the dissimilarities. So now the child will be recognizing who is a man and who is a woman. I am a boy, she is a girl. So these differences they will be identifying by looking the ornaments or the hair or dressing types, differences between the dressing pattern. So by identifying these all things, they will be identifying that the father is a man, my mother is a woman, and I am a boy and she is a girl. So this differences between the sexes that they will be identifying. So this is the phallic stage. And phallic stage, it is a period associated with the controversial issues of Oedipus and Electra complexes like penis envy and castration anxiety. So this Oedipus complex and Electra complex, that is mean during this stage, the child loves the parent of opposite sex as the provider of sensual pleasure. Child will be more comfortable in the parent of opposite sex. Boys will be more attached with the mother and the girls will be more attached with the father. So that they will be getting some amount of pleasure or satisfaction when they are interacting with the parent of opposite sex. So this is the stage of phallic stage and psychosexual development period. So the child will show Oedipus complex and Electra complex. Oedipus complex for the boys and Electra complex for the girls. So boys will be liking the mother, that is known as Oedipus complex. Electra complex is for the girls, that they like the father. The next stage is latency stage. That is fourth stage is latency stage. And this happens in school age period. School age period, that is 6 to 12 years. Normally for boys and girls, like girls they will be becoming adolescent early, but usually in latency stage will be continuing for 6 to 12 years. So at the beginning of latency stage, the child has resolved or is resolving the Oedipal conflict. Children form close relationships with other of their own age and sex. So now they will be knowing the differences between the sexes, and during this latency stage, they will be trying to make a relationship of their own sex, their own age group. So this is known as the latency stage, and they will be hating the opposite sex peer member. So that is about the latency stage. So they will be resolving the Oedipus complex and Electra complex, the conflict, and they will be trying to make the same sex peer group relationships. So they will be hating the opposite sex and they will be liking their own friends. So that is a latency stage. And next is genital stage, that is a pubescent and adolescence. So they will be having this genital stage, and it happens between 12 to 20 years. So during this time, secondary sexual characteristics appear in both sexes. So they become adolescent, the secondary sexual characteristics will be appearing. The same psychosexual conflicts that occurred during the Oedipal period are revived. So they will be trying to make company with the opposite sex, because in the latency period they will be hating the opposite sex. That again in genital stage they will be trying to make company with the opposite sex. If children resolve the conflicts, they are free to enter into heterosexual relationships as adults. So the problem of latency stage, hating the opposite sex, will be diminishing, and during this time they will be trying to make relationships with the heterosexual relationship with the just like adults. So this is the genital stage. So till adolescence, there are 5 stages in psychosexual development by Sigmund Freud. The first one is oral stage. This happens in infancy. The second one is anal stage. This happens in toddler period. The third stage is phallic stage. That is happens in the preschool period. Latency stage, it happens in the school age period. And genital stage, that is happening in the adolescent age. So according to Sigmund Freud, sexual pleasure or the sensual pleasure is not arising suddenly after a particular age. This is present throughout the life of the individual, immediately after birth till the death of the person. This sexuality is there, and the person will be taking pleasure in different areas in each stages. So in each stage, sensual pleasure will be from one area to another, it will be changing. In oral stage, it was the oral area. The second one, anal stage, it was the anal area. The third one is the phallic stage. They will be identifying the sexual differences, and they will be trying to make the sensual pleasure by keeping the relationship between the parent of opposite sex. Latency stage, they try to make the pleasure by making company with the same sex, same age group child. And the genital stage, they will be trying to make the sensual pleasure by making relationships with a heterosexual relationship, and they will have the secondary sexual characteristics. That's why the genital stage. So this is according to the psychosexual development by Sigmund Freud up to adolescence, and this will be continued in the adulthood also, that you will be studying in the psychiatry classes. Thank you for kindly listening. We'll continue with the another